So good evening to all of you. So students, let us discuss about the duodenum and the pancreas. Now, I am Dr. Pradeep Pawar, Professor of Anatomy. I have been teaching anatomy for the last 21 years, mentoring students for the postgraduate entrance preparations. Okay, we'll start with the duodenum. Now students, duodenum has got 4 parts. Like we all know, the first part, second part, third part and fourth part. What is the length of the first part? Length. The length of the first part is 5 centimeters. 5 centimeters long. And what is the vertebral level? The vertebral level of the first part. At what level does it lie? The duodenum is something like this. So the first part is 5 centimeters in length. 5 centimeters in length. And it lies opposite to L1 vertebrae. L1 vertebrae. Okay. Good evening. Good evening to all of you once again. Now I'm starting with the duodenum here. So the first part of the duodenum is 5 centimeters, lies opposite to the body of L1 vertebrae. L1 vertebrae. The second part, this becomes the second part. The second part is 7.5 centimeters in length. 7.5 centimeters in length. Extends from L1 to L3 vertebrae. L1 to L3. The third part. Yes, what is the length of the third part? 10 centimeters in length. 10 centimeters in length. What is the vertebral level at which it lies? L3. L3. And the fourth part is 2.5 centimeters in length. 2.5 centimeters, and it goes slightly upwards. So what vertebral level does it lie? L2. L2 vertebral level. Clear students? So that's about that's the position of the duodenum. Now this entire duodenum is a retroperitoneal structure. It's right behind the peritoneum. Clear? So the entire duodenum is retroperitoneal except a small area of the first part. That's half of the first part, and a small area of the fourth part, which is covered by peritoneum. So we call this as intraperitoneal. First part is 5 centimeters. 5 centimeters. Amit 5 centimeters. Okay. So the first part 5 centimeters, out of which 2.5 centimeters is intraperitoneal, and the last part is 2.5 centimeters, out of which half of it is intraperitoneal. Now how does the first and the fourth part becomes intraperitoneal? Because the stomach is enclosed by the less omentum. The less omentum splits, encloses the stomach and goes down as greater omentum. So when it encloses the stomach, students, it also encloses a small area of the first part of duodenum, first part. And that's how the first part of the duodenum is partially intraperitoneal and partially retroperitoneal. Same for the fourth part. After the duodenum, you have the jejunum, and the jejunum is covered by what? Mesentery. And this mesentery also covers a small area of the fourth part of duodenum. So the fourth part of duodenum is partially intraperitoneal. Partially intraperitoneal and partially it is retroperitoneal. Fine students. So now starting with the relations of the duodenum, just understand these relations. The first part of the duodenum, here I'll start. Now the first part of the duodenum is 5 centimeters in length. 5 centimeters. And the first part of the duodenum is anteriorly related to what? The first part of the duodenum would be anteriorly related to, look at this, that's the gallbladder. Now which part of the gallbladder comes and gets related to the first part? The body of the gallbladder. The body of the gallbladder. The fundus of the gallbladder is related to the transverse colon. Remember, fundus of the gallbladder related to the transverse colon anteriorly, and the body of the gallbladder is related to the first part of the duodenum anteriorly. Clear? So the first part of the duodenum anterior relation is going to be the body of the gallbladder, right? And the fundus of the gallbladder would be related to the transverse colon. Now the first part of the duodenum, who's related behind it, behind the first part? We have got three structures behind the first part of the duodenum. Anyone? Yes, can anyone answer this? Posterior relations of the first part of the duodenum. I'll just put a screen for you. One moment. Yes, students, posterior relations of the first part of the duodenum. If I make this as the first part of the duodenum, that's the second part, that's the third part. Now tell me, this is the pancreas here, pancreas, and that's the uncinate process. Tell me, students, there's a vein which comes here like this, there's a vein which comes here, and there's a vein which goes here, there's a vein coming from behind the body of the pancreas, and something is formed here. Yes, students, what is this? This is the formation of portal vein. Formation of portal vein. So where is the portal vein formed? Students, portal vein is formed behind the first part of the duodenum. We are talking first part. Portal vein is formed behind the neck of the pancreas, neck. And the same portal vein now goes behind the first part of the duodenum, right? And that's the portal vein. This is how we classify the portal vein. Students, if you have seen the portal vein, how do we classify the portal vein? The supraduodenal part, the retroduodenal part, and the infraduodenal parts, right? So supraduodenal, this is with respect to what? Duodenum. So the supraduodenal part is related here above the first part of the duodenum. This will be the retroduodenal, and here hoga infraduodenal part. So retroduodenal part, the first part of the duodenum, posteriorly would be related to what? The portal vein. Portal vein. The first part of the duodenum would be posteriorly also related to, what is this? This is the duct here which comes and opens into the second part of the duodenum. So that's the bile duct, right? So posterior relations of the first part of the duodenum, the portal vein, the bile duct, and there's an artery, students. There's an artery here. Anyone? What is an artery behind the first part of the duodenum? And this artery, yeah, have a look at this. Posterior relations. Look at this MCQ. You'll be able to answer this. Yes, look at this MCQ. Any hints? While what happens is ulcers are very common in the first part of the duodenum, and ulcers are common on the posterior wall of the first part of the duodenum. So 55 years old man comes to a physician because of 3 weeks, very good, history of intermittent burning epigastric pain. His pain improves with antacid use and eating, but returns approximately 2 hours following meals. He has a history of chronic osteoarthritis, takes ibuprofen. Upper endoscopy shows a deep ulcer located on the posterior wall of duodenal bulb. The ulcer is likely to erode. Yes, which of the following structures? Your answer is the gastroduodenal artery. Gastroduodenal artery. So posterior relations of the first part of the duodenum is going to be the gastroduodenal artery. And if there's an ulcer in the first part on the posterior wall, it is going to erode the gastroduodenal artery. It is going to lead to hemorrhage. Clear? So answer is gastroduodenal artery. Clear, students? So the first part of the duodenum is clear to all of you. First part of the duodenum anteriorly would be related to the body of the gallbladder. The first part of the duodenum ka posterior relation is going to be the portal vein, the bile duct, and the gastroduodenal artery. Is this clear to all of you? That's about the first part of the duodenum. Now coming to the second part of the duodenum. That's the second part of the duodenum. The second part of duodenum extends from L1 to L3 vertebrae. It extends from L1 to L3 vertebrae. The second part of duodenum is completely retroperitoneal. It is behind the peritoneum. Retroperitoneal. Now if you can tell me, what is this structure? What is this structure which is crossing the second part of duodenum in front? The same structure is crossing the entire length of the pancreas. What is this structure, students? This is the transverse colon and the transverse mesocolon. Yoga transverse mesocolon. So anteriorly, the second part of the duodenum and the entire pancreas is crossed by whom? The transverse colon and the transverse mesocolon. So anterior relation of the second part of duodenum is going to be what? The transverse colon, right? And posterior relation of the second part of the duodenum. Who's this behind? Yes, who's this behind the second part of the duodenum? This is the kidney, the right kidney. So the posterior relation of the second part of duodenum is going to be the right kidney and the hilum of the kidney, hilum and the right kidney. Simple? Clear to all of you? So posterior relations, the second part of the duodenum is clear. Anteriorly related to the transverse colon, posteriorly related to the right kidney. Right kidney, that's the second part. Now students, coming to the third part of the duodenum, just have a look at this. The third part of the duodenum, what is the length? 10 centimeters. What is the vertebral level? L3, right? And it is completely retroperitoneal. I'll repeat this, just listen to this, completely retroperitoneal. So now students, anterior relations of the third part of the duodenum. If you can tell me, what are these vessels? These vessels lie on the uncinate process of pancreas. What are these vessels related to the uncinate process of the pancreas? Anyone? These are the superior mesenteric vessels. So anterior relation of the uncinate process of pancreas kya hoga? Superior mesenteric vessels. The same superior mesenteric vessels would be related anteriorly to the third part of duodenum. Third part of duodenum. Yes. Okay. Wait, I'll tell you. So anterior relation of the third part of duodenum would be the superior mesenteric vessels. Superior mesenteric vessels. And what is this, students? What is this? What is this line representing? This line is representing the attachment of the mesentery of the small intestines. Okay, the small intestines are enclosed by the peritoneal covering. We call this as the mesentery. And the mesentery is attached to the posterior abdominal wall. This is what we call as the root of mesentery. So this is the root of mesentery. So anterior relation, anterior relation of the third part of duodenum is going to be the superior mesenteric vessels and the root of mesentery. Clear to all of you? Is this clear, bachcho? So third part of the duodenum, देखिए once again, third part of the duodenum is anteriorly related to the superior mesenteric vessels and the root of mesentery. Now the posterior relation of the third part of the duodenum, have a look. The posterior relation of the third part. Who's this vessel? This big vessel? The aorta. That's the aorta. What is this vessel? That's the IVC. What would this be? This is a muscle, students. This is a muscle. What muscle is this? The psoas major. And on the psoas major lies a tubular structure. Anyone? What is that tubular structure which lies on the psoas major? That's the ureter. The right ureter. The right ureter would be anteriorly related to, posteriorly related to the third part of duodenum. Okay, look at this. And this would be the gonadal vessels. So third part of the duodenum ka posterior relation, if you go in a sequence here, one, the right psoas major, the right ureter, the IVC, the aorta, and the gonadal artery. The gonadal artery is not drawn here. So this becomes the posterior relations of the third part of the duodenum. And finally, the third part then becomes the fourth part of the duodenum. The fourth part of the duodenum goes slightly upwards. It is related to the L2 vertebrae. And what are the posterior relations of the posterior relation of the fourth part of the duodenum would be, one is the sympathetic chain, the inferior mesenteric vein. That's the inferior mesenteric vein. That's the left psoas major and the left gonadal vessels. You can just put the fourth part of the duodenum like this. So this becomes the posterior relations of the fourth part of the duodenum. The sympathetic chain, the inferior mesenteric vein, the right psoas major, and the right gonadal vessels. So this becomes the posterior relations. One moment. Okay, so that's about the duodenum. Once again, I'll just quickly go through it. If there are any doubts, you have to ask me. Let me finish this. So now, the first part of the duodenum. Once again, the first part of the duodenum, I'll just quickly go through it. The length of the duodenum is 25 centimeters. That's 10 inches. The entire duodenum is retroperitoneal except a small area of the first part and a small area of the fourth part is intraperitoneal. So starting with the first part length is 5 centimeters related to L1 vertebrae. It is partially intraperitoneal. The first part would be anteriorly related to the body of the gallbladder. Here like this, the body of the gallbladder, yes. And just to add to it, the fundus of the gallbladder would be related to the transverse column. The posterior relations of the first part of the duodenum are going to be 1. The bile duct, the portal vein, and the gastroduodenal artery. Gastroduodenal artery. A very common MCQ which is given there, ulcers on the first part of the duodenum are going to erode which artery? Your answer is gastroduodenal artery. Gastroduodenal artery. Clear, students? Now, the second part of the duodenum. The second part of the duodenum, what is the length? 7.5 centimeters. Extends from L1 to L3 vertebrae. L1 to L3 vertebrae. It is completely retroperitoneal. Anteriorly, the second part of the duodenum would be crossed by the transverse colon and transverse mesocolon. The transverse colon and transverse mesocolon. Posteriorly, the second part of the duodenum would be related to the right kidney and its hilum. Right kidney and its hilum. ठीक है? The first and the second parts are clear to all of you, बच्चों? Yes, students? Clear with the first and the second parts. Any doubts you have, you ask me. In the first and second part, then I'll just quickly go to the third and the fourth part. Any doubts? Okay. Now starting with the third part of the duodenum. The third part of the duodenum is 10 centimeters in length. 10 centimeters. What is the vertebral level? L3. L3. It is completely retroperitoneal. Completely retroperitoneal. Anteriorly, it is crossed by the superior mesenteric vessels and the root of mesentery. Root of mesentery. Students, you know, this third part of the duodenum, who's lying anteriorly, the superior mesenteric artery, and who's posteriorly related to the third part, the aorta. And this third part of the duodenum can get compressed between the superior mesenteric artery and the aorta, and this is what we call as the superior mesenteric artery syndrome, or this is what we call as the Wilkie syndrome. Wilkie syndrome or the superior mesenteric artery syndrome, right? So third part of the duodenum ka anterior relation would be the superior mesenteric vessels and the root of mesentery. The posterior relation would be the right psoas major with the right ureter, the right gonadal vessels, the IVC and the aorta. Yes, very good. And the fourth part of the duodenum goes upwards related to L2 vertebrae. Related to L2 vertebrae, it is partially retroperitoneal. The posterior relations of the fourth part of the duodenum is going to be the sympathetic chain, the inferior mesenteric vein, the left psoas major, and the left gonadal artery, the left gonadal vessels, you can see. So that's it. That's about the duodenum. Students, if you can answer this, what is the blood supply? What is the blood supply of the duodenum? You know, duodenum is partially derived from foregut and partly it is derived from midgut. What is that level? The opening of bile duct. At the opening of bile duct. Above the opening of bile duct, that part of the duodenum is derived from foregut. Below the opening of bile duct, that part of the duodenum is derived from midgut. So what is the blood supply? Blood supply of the duodenum. Above the opening of bile duct would be celiac trunk. Below the opening of bile duct would be the superior mesenteric artery. Tell me, which branch of celiac trunk is this? Which branch of celiac trunk? Yes, anyone? Yes, anyone? Answer. Which branch of celiac trunk is it? Which supplies the duodenum? Above the opening of bile duct. Yes. Bolo. Come on, students. That's the superior pancreatico-duodenal artery. Superior pancreatico-duodenal artery supplies the duodenum above the opening of bile duct, and below the opening of bile duct would be the inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery. Clear? So above this is superior, below this is inferior pancreatico-duodenal artery. Clear to you? Okay, so that's about the duodenum, students. Now I'll tell you about the pancreas. We'll go for the pancreas then. Okay, starting with the pancreas. So what are the parts of the pancreas? Students, what are the parts of the pancreas? I'm starting with the pancreas now. Look, this is the head of the pancreas, that's the neck, that's the body, and the tail of the pancreas. What is this part of the pancreas? That's the uncinate process of the pancreas. Clear? So that's the head, neck, body, and tail. That's the uncinate process of the pancreas. Now this pancreas is entirely surrounded by what? What is this? That's the duodenum. The first part, the second part, and the third part of the duodenum. Now students, if you can tell me, what is this structure related to the superior border of the body of the pancreas? That's the splenic artery. Splenic artery related to the superior border of the body of the pancreas. What is this structure related behind the body of the pancreas? So whatever is easy, whatever we know, I'm just telling you first before we actually go to the pancreas. Who's this behind the body of the pancreas? That's the splenic vein. Splenic vein. And what is this, students? On the uncinate process, that's the superior mesenteric vein. So the superior mesenteric vein is going to join the splenic vein and form what now? That's a portal vein. Portal vein. So behind the body of the pancreas, it will be the splenic vein. Superior related to the body of pancreas would be the superior mesenteric artery. Behind the neck of the pancreas would be portal vein. ये हो गया portal vein in its upper part, portal vein in its upper part, and superior mesenteric vein in its lower part. Superior mesenteric vein in its lower part. Okay, students, someone was crossing this second part of the duodenum and the entire pancreas like this. Who was that? Yes. Who was that? Who was the one who was crossing the entire pancreas and the duodenum second part? That was the transverse colon. Transverse colon. So anterior relation, students, anterior relation of the pancreas is going to be what? The transverse colon and the transverse mesocolon. The entire pancreas anteriorly would be related to the transverse colon and transverse mesocolon. And there's something else here. Look at this, students. What is this structure here? That's the stomach. Stomach. So this part of the pancreas would be related to the stomach. Stomach, है ना? It forms the stomach bed. Stomach bed में याद है? Stomach bed में who's included in the stomach bed? The body of the pancreas. So that's the pancreas, whatever we know. I'll start now with the pancreas. Just have a look at this. Students, starting with the head of the pancreas. Just look at the slide. Whatever is seen in the slides, I'll tell you. It's very easy here. Now that's the head of the pancreas. And the head of the pancreas is anteriorly related to this structure. What is this? That's the first part of duodenum. First part of the duodenum. First part of the duodenum would be anteriorly related to the head of the pancreas. Head. Now, the head of the pancreas would also be crossed by this structure. What is this? That's the transverse colon and mesocolon. Transverse colon and mesocolon. So anterior relation of the head of the pancreas, one is the first part of the duodenum, second is the transverse colon and mesocolon. Now coming to the posterior relations of the head of the pancreas. Posterior relations of the head of the pancreas. Have a look here. Now students, if you can tell me, what was this structure lying here? This structure, what was that? That was the second part of the duodenum. Second part of the duodenum. So what is going to lie here would be the head of the pancreas. The head of the pancreas would lie here. So head of the pancreas ka posterior relation is going to be what? 1. Chalo, start. Answer this. Head of the pancreas for posterior relation is going to be 1. Who's this? Who's this, students? Who's this? What is this structure? If you can tell me, what is this structure? This is the IVC. IVC. That's the IVC. Second. What is this structure? This is the right renal vein. Right renal vein. This is the right renal vein. Third. What is this? Any idea? What is this structure? What is this? Students, what is this structure? Bolo. Whatever you know, you can guess. There's no problem. You can guess this. I'll help you to answer. Ye kaun hai ye? Right renal vessels is fine. Right renal vessels. So IVC, right renal vessels. What's this? What's this? Next to the IVC. Next to the IVC. This one. You're seeing the pointer, no? Vein ke upar hai. Above the vein. And to the right of the IVC. Dekh raha na ye? Oh no. I'll magnify this. नहीं, it's not aorta. One moment, I'll just magnify this for you. ये देखो, ये this one, not this one. I'll magnify this. Yes, you can see that. Bolo, what is that? Yes, got it. Yes, Rusty. Yes, that is the right crus of the diaphragm. That's the right crus of the diaphragm. Yes, that's the right crus of the diaphragm. And there was a duct here. There was a duct which was coming like this, and opening in the second part of the duodenum. What is that duct? That's the bile duct. So posterior relations of the head of the pancreas would be 1, the IVC, 2nd, the right renal vein, 3rd is the right crus of the diaphragm, and the 4th is going to be the bile duct. Okay, and tell me now, students, which part of the pancreas is more prone to cancer? Which part of the pancreas is more prone to CA? That's the head of the pancreas. And when there is CA of the head of the pancreas, who's compressed? The bile duct. What does the person get? Obstructive jaundice. The person gets an obstructive jaundice. Is this clear to all of you? Yes? Is this clear? Right. So once again, just have a look at this. The head of the pancreas ka anterior relation. Head of the pancreas ka anterior relation is going to be the first part of the duodenum. The posterior relations of the head of the pancreas would be 1, the IVC, 2nd, the right renal vein. That's the right renal vein. 3rd is the right crus of the diaphragm, and the 4th would be the bile duct. Any doubts in this? See what happens, the artery is lying right behind the vein. Artery and a vein के पीछे होता है ऐसे. Normally if you see the relations at the hilum of the kidney, what are the relations at the hilum? It's the vein, artery and pelvis. So when we talk about the posterior relations of the head of the pancreas, we take the vein and not the artery, because the artery is lying right behind the vein. So we don't call it as renal vessels, we just call it as the right renal vein. Okay, students? Any doubts you have in this, you ask me regarding the head of the pancreas. Bolo. Come on, students. Any doubts in this? Fine. Yes, Shastri. Okay, so that's about the head of the pancreas. Head. Now, students, if you tell me, that's the head. Now, what is this part of the pancreas? Just before the head is the neck of the pancreas. Neck. Look, students, if the head is related to the first part of the duodenum, thoda sa pehle, slightly before the head, before the first part of the duodenum, what is this going to be? Slightly before the first part of the duodenum. Ye kya hoga, bachcho? What is this going to be? The pylorus of the stomach. So anterior relations of the neck of the pancreas. Kya hoga? Anterior relation of the neck of the pancreas is going to be the pylorus of the stomach. Clear, students? That's how you remember it. So anterior relation of the neck of the pancreas would be the pylorus of the stomach. And students, posterior relations of the neck. Ye kaun hai? What is this vein here? Superior mesenteric vein. The superior mesenteric vein goes up. It is lying on what? Uncinate process. Dekho. The superior mesenteric vein is lying on the uncinate process. The same superior mesenteric vein goes up. जब ये superior mesenteric vein, when it goes up, it is going behind the neck of the pancreas. Remember, students, it is going behind the neck of the pancreas. So the posterior relation of the neck would be the superior mesenteric vein. Fine. And what is this vein here behind the body of the pancreas? Ye dekho kaun hai? Who's this? That's the splenic vein. And the superior mesenteric and the splenic now joins to form what? That's the portal vein. Right? So when we talk about the posterior relation of the neck of the pancreas, yes. When we talk about the posterior relation of neck, there are two veins. Yes, there are two veins. In the upper part, students, in the upper part, that this is going to be the portal vein. In the lower part, this is going to be the superior mesenteric vein. I hope I'm clear to all of you. Okay, I hope I'm clear to all of you. ठीक है ना? तो neck of the pancreas का posterior relation would be the portal vein in its upper part and the superior mesenteric vein in its lower part. Perfect. Anterior relation of the neck of the pancreas is going to be the pylorus of the stomach. Pylorus of the stomach. So that's about the neck of the pancreas. Neck. Okay, so that's about the neck. Now coming to this process. What is this process? This is the uncinate process of the pancreas. Yeah, ऐसे. So that's the uncinate process of the pancreas. Now, what is anteriorly related to the uncinate process? If you can answer this, see these two vessels. Anterior relations of the uncinate process of pancreas is going to be the superior mesenteric vessels. The superior mesenteric vessels. Yes. And the posterior relation of the uncinate process. The posterior relation, superior mesenteric vessels, दोनों होंगे, दोनों. Okay, superior mesenteric vessels, artery and vein, both are related anteriorly to the uncinate process. Posteriorly, students, the uncinate process would be related to what? What is this big artery here? The aorta. Aorta. So, one thing I would like to mention here, students, to all of you. So, ये देखो, एक मिनट, just one moment. Tell me if that's the aorta, if that is the aorta like this, and if that's the superior mesenteric artery. ठीक है ना? Between the superior mesenteric artery and the aorta, what are the structures which lies in a sequence? What are the structures which lie in a sequence? One we have just seen. ये कौन है? This is a structure with a lumen. Who's that? Answer the students. What is this structure between the superior mesenteric artery and the aorta? The structure with the lumen. Yeah. This one. The lowest one. That's the duodenum. Yes. Which part of the duodenum is this? The third part of the duodenum. Okay. Right above this is the left renal vein. So this is going to be the left renal vein. Very good. This is going to be the third part of the duodenum. Anything else comes here? और कोई है? और कोई structure है between the superior mesenteric artery and the aorta? This is going to be the uncinate process of pancreas. Uncinate process. Very good. So between the aorta and the superior mesenteric artery, there are three structures from above downwards. Just remember. The first one is the left renal vein. The second one is the uncinate process of pancreas. And the third one is going to be the third part of duodenum. Clear, students? So now this left renal vein can get compressed between the superior mesenteric artery and the aorta. And compression of this left renal vein is what we call as, anyone, what is this known as? Compression of the left renal vein between the superior mesenteric artery and the aorta is known as? Yes, very good. Shasti, yes. That's the nutcracker sign. ठीक है, इसको बोलते हैं nutcracker sign. So that's the compression of the left renal vein. Yes, very good. Between the superior mesenteric artery and the aorta. So that's the nutcracker sign. And what is this compression of this third part of the duodenum? This is known as the SMA syndrome. Okay, or this is also known as the Wilkes syndrome. SMA syndrome or Wilkes syndrome. Clear, students? So I'm done with the head of the pancreas, the neck of the pancreas, and the uncinate process of pancreas. Okay, I'll just jot this down for you. If you can quickly tell me. Just quickly tell me, head of the pancreas. Anterior relation क्या था? From what all you have understood and what all you can recollect. चलो, answer this. Anterior relations of the head of the pancreas. Anyone? Come on, answer. Answer. Anterior relation of the head. Just remember the slides which I've shown you. These are very important slides and very good. That's the first part of the duodenum, right? Anterior relation of the head of the pancreas is the first part of the duodenum, and the transverse colon with transverse mesocolon. Transverse colon with transverse mesocolon. Posterior relation of the head of the pancreas would be IVC. The right renal vein. Very good. IVC, the right renal vein. What else? Just try to recollect it. Bolo. That's fine. IVC, the right renal vein, the right crus of the diaphragm, and one more, bile duct. Very good. Bile duct. Bas ऐसे याद रखना. This is extremely important. Okay. So if you try to recollect like this, now it becomes very easy to understand. Okay, that's the head. Now starting with the neck of the pancreas. Neck of the pancreas ka anterior relation. Anyone? Neck of the pancreas ka anterior relation. If that was the first part of the duodenum, how do you remember this? If the first part of the duodenum is related anteriorly to the head, thoda sa pehle kya hoga? Thoda sa pehle. That would be the pylorus. Very good. Pylorus of the stomach. And posterior relation of the neck of the pancreas would be the superior mesenteric vein in its lower part. I make it lower part, and portal vein in its upper part. Right? So superior mesenteric vein in its lower part and the portal vein in its upper part. Perfect. Be very clear. Huh? So once you get out of this lecture, you should be able to recollect all these things that we have gone through it. So that's about the neck of the pancreas. Now, uncinate process. Anterior relations. बोलिए. Uncinate process का anterior relation क्या था? Students, uncinate process का anterior relation was superior mesenteric vessels, vessels, both artery and vein vessels. Posterior is the aorta. Posteriorly is the aorta. Perfect. Very good to all of you. Perfect. That's excellent. Now, coming to the body of the pancreas. Uncinate process का posterior relation is aorta. Fine. Now, coming to the body of the pancreas. This is a difficult relation to remember, the body of the pancreas. Whatever is easy, first I'll tell that. Students, just try to understand it like this. Because superior mesenteric vein is lying on the uncinate process. Take care. Superior mesenteric vein lies on the uncinate process, and when this superior mesenteric vein goes up, it goes behind what? When the superior mesenteric vein goes upwards, it goes behind what? Yes, students, it goes behind what? The neck of the pancreas. It goes behind the neck of the pancreas. Neck of the pancreas. Thoda sa difficult hai, just try to understand. And when this superior mesenteric artery goes up, it goes behind what? The body of the pancreas. It goes behind the body of the pancreas. You understanding, students? That's the difference. Both of them are related to the uncinate process. Fine, agreed. But when you trace the superior mesenteric vein upwards, it goes behind the neck. And when you trace the superior mesenteric artery upwards, it goes right behind the body of the pancreas. Body. Clear to all of you, students? No confusion. And this superior mesenteric artery arises from what? It's a branch of abdominal aorta. So यहाँ पे this big vessel would be there. This big artery is going to be there. What is this big artery? Aorta. So it is going to be the aorta with the origin of superior mesenteric artery. I'm telling you the posterior relations of the body of the pancreas. Are you following, students? Posterior relation of body of pancreas क्या होगा? Aorta with the origin of superior mesenteric artery. ठीक है? Now, what else will be related to the body of the pancreas? What is this structure? Look, I marked it. I put a star on that. I put a star on this structure. What is this structure? Answer, bachcho, answer. What is this structure which is related posteriorly to the body of the pancreas? This is the left kidney. Left kidney. This is going to be the left suprarenal gland. Left kidney, left suprarenal. And there's a vein behind the body of the pancreas. What is this vein going to be behind the body of the pancreas? This is going to be the left renal vein. Left renal vein. So posterior relations of the body of the pancreas. Don't write anything, I'll give you this. Posterior relations of the body of the pancreas. One is the left kidney. Second is the left suprarenal gland. Third is the splenic vein. Fourth is the aorta with the origin of superior mesenteric artery. Aorta with the origin of superior mesenteric artery. And there are other structures also, but we can't see this. Students, क्या करते हैं? What do? We take this pancreas down. ऐसे ना pancreas को नीचे लेते हैं. We are taking the pancreas down, down, down. We are retracting the pancreas down to see the posterior relations. Look, we'll just take the pancreas down. थोड़ा सा retract करते हैं pancreas को to see the posterior relations. Look at this now, students. This is a very good slide. This is a very good slide. I've put this specially for you. Look at this slide. Wow, that's good. अब देखिए, I've magnified this. एक मिनट, let it get settled. Okay, that's so nice. And you tell me the pancreas was going like this. Students, pancreas was going like this, है ना? ऐसे जा रहा था ये pancreas. What have we done? We have taken the pancreas down. We have retracted it downwards so as to see the posterior relations. Look how nice. This will be the posterior relations of the body. I'll start. One. Who's this? The left kidney. Second, the left suprarenal gland. Third, what's this vein? This is the vein that I was telling you. ये जो vein है ना, splenic vein, splenic vein. Then look at this, students. The aorta with the origin of superior mesenteric artery. Clear है? So the aorta with the origin of superior mesenteric artery. Then would be the left renal vein. Left renal vein. And what is this, students? ये देखो. See. What's this? What's this? That's the left crus of the diaphragm. The left crus of the diaphragm. This is the left crus of the diaphragm. Remember, students, the left crus of the diaphragm also comes in relation to an organ. Which organ is this? The left crus of the diaphragm is also posteriorly related to someone. Can you answer this? Can you answer this? The left stomach. The left crus of the diaphragm is also posteriorly related to the stomach. ठीक है, stomach bed में आता है left crus of the diaphragm. The same left crus, students, goes down would be forming the posterior relation of the body of the pancreas. Left crus, posterior relation of body of the pancreas. Once again, have a look. Posterior relations of the body of the pancreas. Understand this. One is the aorta with the origin of superior mesenteric artery. Second, the left renal vein. Third, the left crus of the diaphragm. Fourth, the left kidney. Fifth, the left suprarenal. And sixth is the splenic vein. Splenic vein. Perfect. Is this clear to all of you? ठीक है. So I'll just mention this for you quickly. Perfect now, students, enjoying? समझ में आ रहा है ना? Okay. So starting with the body of the pancreas. Body of the pancreas का posterior relations, I'll just tell you. One would be the aorta with the origin of superior mesenteric artery. ठीक है? Aorta with the origin of superior mesenteric artery. Second, left renal vein. Left renal vein. Left crus of the diaphragm. Left crus of the diaphragm. Next, left kidney. Left kidney. Left suprarenal gland. Left suprarenal gland and splenic vein. Splenic vein. That's it. Splenic vein. Clear? Perfect. कुछ doubts है तो बोलो. Any doubts you have? Anyone has? You ask me. Students, clear है? If anyone has got any doubts, you can ask me. So this becomes the posterior relations of the body of the pancreas. Now, anterior relations of the body. Yes, anterior relations of the body is going to be what? Anterior relations of the body of the pancreas would be ye dekho kaun hai? Who's this? The transverse colon and the transverse mesocolon. Yes, anterior relations of the body of the pancreas will be the transverse colon and transverse mesocolon, and the stomach. The stomach. So anterior. I'll put the previous slide. Just one moment. I'll put the previous slide. Previous slide is what? The writing one. Okay. The writing slide is gone. Anyway, I'll put the slide. Look. Now, the anterior relations of the body. Aap likhiye, anterior relations. We're writing the body of the pancreas. Now, anterior relations of the body would be the transverse colon and mesocolon. The transverse colon and mesocolon. Second, the stomach. Transverse colon and mesocolon and the stomach. So that becomes the anterior relation. Superior relation. Superior relation is going to be, what is this? Artery on the superior part of the body of the pancreas. What's this artery? That would be the splenic artery. The splenic artery. Splenic artery. That's it. See, this was a slide. This was a slide. Once again, I'll tell you the posterior relations of the body of the pancreas. One is the aorta with the origin of superior mesenteric artery. Here, aorta with the origin of superior mesenteric artery. Second is the left renal vein. Third is the left crus of the diaphragm. Fourth, the left kidney. Fifth, left suprarenal. Sixth, splenic vein. Clear now? Chandrakanta, clear? So that's it. If you can answer this MCQ for me. All the following statements about relations of the pancreas are true except. If you can answer this. Shasti. Yes, the rest of you answer. क्या हुआ? Splenic vein था, splenic vein. Okay, right renal vein lies behind the head. क्या बोलते हो? Correct है? All the following about the relations of the pancreas. So right renal vein lies posterior to the head. Correct है ना? Posterior relations of the head क्या था? The IVC, the right renal vein, the right crus of the diaphragm, and the bile duct. Yes, so this is correct. Superior mesenteric artery lies anterior to the uncinate process. Correct. Anterior to the uncinate process is superior mesenteric artery and the vein, both of them. Yes. First part of duodenum lies posterior to the head. That's wrong, students. The first part of the duodenum lies anterior to the head, not posterior. That's in front, anterior to the head. Superior mesenteric vein lies behind the neck. What do you say? What do you say about this option D? Bolo bachcho, what do you say about this option D? Superior mesenteric vein lies behind the neck. Yes? Yes, students? Yes, correct. Be specific, be specific. Superior mesenteric vein lies behind the neck. To complete the sentence. Complete the sentence. Superior mesenteric vein lies behind the neck in the lower part. In the lower part. In the lower part. Behind the neck is the superior mesenteric vein. And in the upper part, the posterior relation of the neck is going to be portal vein. Very good, very good, very good. ठीक है ना? So I just want you to understand, students, neck of the pancreas के पीछे there are two veins. In the upper part it's the portal vein, in the lower part it's the superior mesenteric vein. Perfect to all of you students, perfect. And last is the tail of the pancreas. What is left? So we have done with the head of the pancreas, neck of the pancreas, uncinate process, the body of the pancreas, students. The tail of the pancreas. Tell me now, this tail of the pancreas lies in a ligament. What is that ligament? It lies in the lino-renal ligament. The lino-renal ligament it lies, and the tail of the pancreas enters the hilum of the spleen. It enters the hilum of the spleen. It lies in the lino-renal ligament, the lino-renal ligament. And this tail of the pancreas contains the maximum islets of Langerhans. The maximum islets of Langerhans are present in the tail of the pancreas, and if we cut this tail while doing a splenectomy, if the tail is cut, the person will land into diabetes mellitus. The person will land into diabetes mellitus because, okay, right. So now before I continue, I'll just tell you the development of pancreas. So before I proceed, I'll just brief you about our platform, about our courses. We have a NEET PG Compact course. We have got a NEET PG Compact. It's on 10th October at 11 AM. So this will contain 45 questions of 60 minutes. So 45 questions of 60 minutes, 10th of October, 11 AM. Be sure to give this test, and there are plenty of scholarships which Unacademy is going to offer. Just have a look at the website. Now, raise a hand technique, in which if you press the icon, you can directly talk with the educator. Now we have slashed down the prices of our iconic subscription. Just have a look at this offer. You can avail these prices, refer to your friends. We have got a highly effective and updated question bank of over 25,000 plus questions with detailed explanatory answers, and these are our students whom we are proud of. They have got very good ranks in the recent test exams. Now students, we are starting with Target NEET 2022 batch from 29th of September. We are starting with Mission INICET 2021 batch from 29th of September. Also 2 more batches coming up, Focus FMG batch and Clinical Examinations and Procedure batch from 29th of September. Now boost your medical preparations with 2 years, 24 months, you get 4 months free, and with 1 year, that's 12 months, you get 2 months free. Download the Unacademy app. Okay, so download the Unacademy app. So these are the various courses. Okay, students, now tell me something about the development of pancreas. We come to now pancreas. See, here gut, GIT. The GIT is derived from what? Endoderm. So the entire GIT is lined by what? Endoderm. अब ये जितने भी pouches होंगे, you get small diverticulum, you get small pouches from the GIT, a small diverticulum for the liver, a small diverticulum for the pancreas. All this diverticulum which are derived from the GIT are what in origin? Endodermal in origin. These are endodermal in origin. So now look, this is the midgut, and this is the foregut, and this is the midgut. At the junction of foregut and midgut, we get a diverticulum for the liver. Here we call this as the hepatic diverticulum, right students? That's the hepatic diverticulum. We get another small diverticulum for the gallbladder, and this is what we call as the cystic diverticulum. Fine students, at the junction of hepatic diverticulum and the gut, we get a bud here. What is this bud? The ventral pancreatic bud. Exactly at the opposite side, we get another bud here, named the dorsal pancreatic bud. So both these buds are derived from the GIT. Both these buds are therefore what in origin? Endodermal in origin. Okay? So at the junction of the hepatic diverticulum and the gut, you get the ventral pancreatic bud. Exactly at the opposite side, you get the dorsal bud. This ventral bud will go from backside. It will go from backside like this. One moment. It will go from backside. It will go and join with what? The dorsal bud. So the ventral bud will migrate from behind, will come and join with the dorsal bud. But students, sometimes half of the ventral bud goes from back, half of the ventral bud comes from front, and such a type of pancreas is going to encircle the duodenum, and this is what we call as annular pancreas. So annular pancreas is due to defective migration of what? the ventral pancreatic bud. Okay, so annular pancreas is due to defective migration of the ventral pancreatic bud. Now sometimes the ventral bud does not fuse with the dorsal bud, right? Sometimes the ventral and the dorsal bud do not fuse. In this case we get a divided pancreas, and this is what we call as the pancreatic division. Pancreatic division. This is the most commonest abnormality of the pancreas. That's pancreatic division. That's the first commonest abnormality, followed by annular pancreas. Remember, so pancreatic division followed by annular pancreas. Clear, students? Now you have to know what is the dorsal bud form, what is the ventral bud form. I'll just quickly enumerate this for you. Right, what is the dorsal pancreatic bud form? Okay, I'll start with this, just one moment. What is the dorsal pancreatic bud going to form? So it forms the upper part of the head, the neck, the body and the tail of the pancreas. The upper part of the head, the neck, the body and the tail of the pancreas. What is the ventral pancreatic bud going to form? The ventral pancreatic bud is going to form the lower part of the head and the uncinate process. The lower part of the head and the uncinate process is derived from the ventral pancreatic bud, whereas the upper part of the head, the neck, the body and the tail of the pancreas is derived from the dorsal pancreatic bud. Clear? Now students, ये किसका duct था? Look, this was the duct of what? Ventral bud. And what was this duct of? This was the duct of the dorsal bud. ये dorsal bud का duct था, ऐसे. And this was the duct of the ventral bud, right? How is the main pancreatic duct formed? I'll just show you the slide, it will be better. So clear now, what is the dorsal bud form, what is the ventral bud form? So the dorsal pancreatic bud is going to form the upper part of the head, the neck, the body and the tail of the pancreas. The ventral pancreatic bud is going to form the lower part of the head and the uncinate process. Now students, this is the duct of the dorsal bud, look. And this is the duct of the ventral bud. How is the main pancreatic duct formed? The main pancreatic duct is derived from the duct of the dorsal bud, the duct of the ventral bud and the anastomosis between them. This is going to form the main pancreatic duct. So main pancreatic duct is derived from the duct of the dorsal bud, the duct of the ventral bud and the anastomosis between them. Fine, perfect. And what is this duct of dorsal bud going to form? This is going to form the accessory pancreatic duct. So accessory pancreatic duct is derived from the duct of dorsal bud, whereas the main pancreatic duct is derived from the duct of the dorsal bud, the ventral bud and the anastomosis between them. Perfect. The main pancreatic duct is known as the duct of Veer-Sung. The duct of Veer-Sung. And where does this duct open, students? This duct is going to open into the major duodenal papillae. It opens into the major duodenal papillae 8 to 10 centimeters from the pylorus. 8 to 10 centimeters from the pylorus. The accessory pancreatic duct is also known as the duct of Santorini. Duct of Santorini. And this opens at the minor duodenal papillae, 6 to 8 centimeters from the pylorus. 6 to 8 centimeters from the pylorus. That's the minor duodenal papillae. Clear to all of you students? So annular pancreas, remember annular pancreas occurs due to defective migration of ventral pancreatic bud. That is a very important thing to remember. And non-fusion of the ventral and the dorsal bud results in a pancreatic division, a divided pancreas. Non-fusion results in a divided pancreas. I hope this is clear to all of you, the duodenum and the pancreas. Any doubts if you have, you ask me. The session is open for doubts. Yes. Any doubts? Students, any doubts you have, you can ask me. I hope everything is clear. Transverse colon and mesocolon. Anterior relation of neck. Yes, transverse colon and mesocolon will be present. Yes, Shastri. The entire pancreas, the head, neck, body and tail would be crossed by transverse colon and mesocolon. But tail ka part will be in the line-orienal ligament and the spleen. I hope this is clear to all of you. Thank you. Thank you for this patient learning, patient listening. If there are any doubts, you can send a mail. Okay. Thank you. Thank you to all of you. So see you tomorrow and day after tomorrow with such sessions. Okay. Thank you once again. I'll stop here. No doubts now? Okay, fine. I'll stop this. Thank you.